I was looking for a doctor, Andrew, and a local physician in the area. And all my friends were like, I really highly recommend Dr. Barke. And he's a boutique physician and who really just, I think that when they say boutique, what does that entail?
Well, listen, everybody has their own opinion. It's concierge is what I like to say.
Concierge, okay.
And the idea is in primary care, a typical primary care physician will maintain a practice base of around 3,000 patients. We limit our doctors to no more than about 400 patients. So about 10% of what normal is as far as a full practice goes. And the idea is so we can spend as much time as necessary taking care of you, catering after your needs, and not catering to the masses.
Great.
And so I think it's important that you have a relationship with a doctor that you trust, that has the time to be responsive to your needs, whether it's a same-day appointment, a text, a phone call, or what have you, that we're there to serve you.
Well, you're always available. Your office always answers. If I have any questions, they have answers. If I need anything, I remember I was going through some stress in my life, and I needed some help, and I didn't really know who to call, and I thought, wait a minute, shouldn't I call my doctor about this? And you came over, and you were right there. To just guide me through what I needed to do for my mini nervous breakdown during that situation.
Well, listen, it's an honor to be a small part of your journey, and I appreciate that you trust in the care that we provide.
Yeah, no, absolutely. So where are you from originally?
Originally born and raised in Southern California.
Oh, you're native?
Yep, I grew up out in the San Fernando Valley.
Okay.
I then moved south and went to college at USC, then further south and went to medical school at UC Irvine, and then stayed behind the orange curtain.
Wow, that's amazing. Andrew, is your daughter going to go to school down here or no?
She'll probably want to go to college down here. I live up by Seattle, and this is just so much nicer weather than I have all the time.
Absolutely. So. Listen, we pay the California price for living here, but there is a lot to love about living in Southern California.
Orange County, I love Orange County.
For sure, absolutely.
Well, and do you find that so you're an Orange County physician, and you cater to the rich and famous in Orange County. I did not know this when I looked at everything that I did some research, but I didn't really research you on Instagram or any of your social profile, and found out later through a lot of significantly some people in Orange County that you are really the doctor to the rich and famous. So I felt very blessed that you chose me as your little,
when you only have
patient.
400 patients or whatever. She's happy.
Yeah,
she's
right. Well,
feel very blessed.
Listen, while it's true that the majority of our patients are affluent, we also believe strongly in giving back to the community.
Yeah.
So a percentage of our patients are on scholarship.
Really?
Yep.
That's great.
Those are patients that can't afford our services.
That's what I was going to ask you.
But we still want to take care of them. Yeah. So we try to maintain about 10% of our patients that are on either a reduced fee or scholarship to be part of our group.
I didn't know that. That's amazing. That's the thing is Orange County is very, very expensive to live in.
It is.
If you want care, more personable care, I know it myself. I take my health seriously, and I don't think every doctor that I had met understood how serious I want to take my health until I met you. And you have different types of physicians in your office, and you have different people that really, they're very intuitive, they know your body. You even had a woman in there that knew how to train you if you have torn muscles. You've got the whole gamut there.
We do. We have 2 full-time personal trainers and a gym within our office.
Yeah.
And so
Wellness.
And we try to look at the big picture. The problem with most primary care doctors is they work for some healthcare institution. Their paycheck is not from the patient. Their paycheck is from a healthcare institution. And as a result, they have a built-in conflict of interest. I don't get a paycheck from an institution. I get a paycheck directly from patients that pay for their membership. So my interest is in serving the patient and doing whatever is in their best interest. So that may be referring them outside of their network, outside of Orange County, but I try to look at each individual patient and do what's best for them, not what's best for the institution. The problem with primary care, and for that matter, healthcare in general, is 100 years ago, a small percentage of physicians worked for large healthcare institutions. Now, a small percentage of physicians are independent, and most doctors work for some large healthcare institution. As a result, they don't get a paycheck from the patient, they get a paycheck from the institution.
Got it.
And so as a result, they can have a conflict of interest. In my situation, we get a paycheck directly from the patient. They pay a membership fee. So it is in our best interest to look after what is best for the patient, not what's best for the institution.
Do you have that in Washington State where you live?
I'm assuming, but I don't. I just have the standard health insurance and standard corporation style of health around where I live. At least that's what I use. And so you're saying is they're just trying to make the corporation happy, not the patient happy.
Correct.
Because they don't care about the patient, they care about the corporation.
Is that pharmaceuticals as well?
Often pharmaceuticals as well. Many physicians get incentivized by big pharma to prescribe drugs and so forth.
Like antidepressants or Adderall, whatever
everything.
they think,
All-
right?
Every
all
time
of
I
the
ever go
above.
to the doctor, they try to give me medicine. I'm like, what can I do to not, I just want to get better, but I don't want to take anything. What's the physical therapy? Do I eat different? Do I run? I don't want to take medicine just to make it go away. I want to make it go away forever. So.
Unfortunately, the allopathic medical model that I was trained under many years ago is a disease model of medicine. That is, we don't have a disease or an illness or a condition where there isn't a pharma solution to it. I've had to unlearn much of what I've learned in medical school. My goal is to get patients off medication, not on medication, and to work with them in a holistic way to get them to heal themselves so they can master their own health, be their own best doctor, so we can keep them out of the hospitals and ultimately keep them out of doctors' offices. Yeah, that's my goal.
I don't want to go, I have no desire to go there, so if they can give me the advice to not visit them is amazing.
Absolutely.
Well, didn't our mom? She got COVID during COVID and the whole terrible situation. And what happened? This is terrible. The situation.
So we go in there. She never got the shortness of breath, but she was super low energy. Like didn't even feel like getting out of bed. Just to
she never goes to the doctor.
So
ever.
we ended up going to the local clinic, and we go in there, and the first thing the doctor said was, "Oh, you didn't take the vaccine? Well, good luck." Mm-hmm. His exact words. He's like, "Well, you're." What did he say? His exact words were, "You're circling the drain," and then just sent her home. Nothing, no advice, no nothing. Just, "Whoa, you didn't take the vaccine?
Couldn't believe
Go
it.
home. That's your fault."
Yeah, that's unbelievable. And unfortunately, informed consent has gone out the window. So we are supposed to, whether it's a vaccine or a medical procedure or a medication that we're going to prescribe, we're supposed to give you informed consent. What are the benefits? What are the risks? What are the side effects? What are the alternatives? And as it relates to a vaccine, what does the package insert in the vaccine actually say? What are the ingredients in the product? What are the documented side effects of the product, et cetera? Nobody gets that anymore. So I'm often accused of being anti-vax. I am not anti-vax. I am pro-informed consent. And typically,
pro-informed consent. That's
informed
great.
consent. And typically, after somebody reads the package insert, the FDA-approved package insert, not the Barke package insert, they'll look at this, they'll see ingredients like aluminum, which is a neurotoxin that's put in many of the vaccines as an adjuvant, a chemical that stimulates the immune system to see whatever is in the vaccine and react to it. They'll see things like polysorbate 80 as a preservative, which if you look it up, don't believe me, Google this.
No, I heard about it.
Can lead to cancer, it can cause gut dysbiosis, et cetera. So there are ingredients in these vaccines that I would never want put in my body. So you simply have to look at what are the potential benefits of the vaccination, what are the downside of the vaccination, what are the ingredients, what are the studies that brought this product to market, and then make an informed decision. I'm not here to tell anybody to get or not get vaccinated. I just want to educate them about what's in the product and what they should know.
What are you putting in your body?
Yeah.
No one told me. So,
Right.
I was working for Bravo, and we got tested for COVID the whole time. Sorry, we got on the COVID conversation right away. I was trying to say that our mom never takes medicine, and she went to the doctor, and he's like, well, if you didn't take the medicine, then screw you. I couldn't believe when he did that to our mom. Like, it hit home.
Yeah, I was actually in the room, so I was just like, are you kidding?
Yeah.
That's unbelievable.
I was just like, it was shocking that literally the guy just said, oh, you didn't take the vaccine? I don't care about you anymore.
It was, we were like, what? Like our mom, like, and you hear about these stories from afar. When it hits your family, you're like, our mom thought she was gonna die. And the guy was like, fuck yourself.
I mean, I know physicians that refuse to treat patients that were unvaccinated for COVID. And it's just ridiculous. Where's the Hippocratic Oath of taking care of patients? If somebody were an alcoholic and they got into an accident, would you refuse to take care of them because what they did was wrong? No, of course not.
Daily Logic Check.
Thank you for tuning in to this episode of Daily Logic Check. I'm Elizabeth Vargas, your host, with my co-host, Andrew Vargas. If you like what you saw, you like what you see, click like, subscribe, follow us, and support us on Patreon. Peace, love, and happiness.